watching Senior Support on YourTV. My name is Debbie MacDonald Moynes. I'm also your host. And when I'm not doing this, I'm the Executive Director of the Prince Edward County Community Care for Seniors Association. We have another community co-producer for the show, and that's Shelley Wirt. Shelley is the Executive Director of Community Care for South Hastings. Today, we're going to cover the topic of osteoporosis. And we have with us the Community Development and Officer with Osteoporosis Canada. Her name is Cathy Pearcy. Welcome, Cathy.
Thank you so much for having me today. I'm looking forward to this.
Yes, and it's really interesting, you know. Cathy, you're coming to us all the way from Lakefield near Peterborough. And that's not something that we would be able to do very easily without a lot of travel under the normal way that we would do this show. And so with Zoom, we can bring in people from all over. And so we're really glad that you're here. We're going to learn something new today.
Well, and the same thing, we're excited to be able to Zoom to areas that we don't have educators, so that we're able to reach people that we haven't been able to reach through Zoom. So thank you for this opportunity.
Well, and this is a great opportunity today, Cathy. So why don't we first of all get to know you a little bit more? Why don't you tell us what brought you to Osteoporosis Canada? How did you end up there?
Yeah, so I've been with the organization for almost 10 years. I started out as the community educator in the Peterborough area, where I would do presentations and talks, talk to patients, health fairs, just really get bone health information out to my local community. 2 years ago, our organization kind of went through a bit of an overhaul. And instead of having chapters, we moved to a locally based volunteer network. So we're looking for volunteers throughout Canada, but my role changed and I became the community education coordinator for the province of Ontario. So I recruit volunteers who can then share the message in their community. And like I said, with COVID, we're now able to do this through Zoom and reach communities that we haven't been able to reach before. So that's kind of how my role started. But I've always been a community educator.
Well, that sounds great. And you're right. There is now a way to get out and educate the community so that they have information on things that they need. And in some ways, we've been able to do this through Zoom in an even better way than we were able to do in the past. And if there's anything good that's come out of this whole pandemic episode, it's some of these new ways of working and new ways of reaching out that we're going to continue to do, I think, into the future. Don't you think?
Oh, absolutely. And connecting in very different ways. So I have patients now that are connecting with each other that would never have met each other before. So there's a silver lining in everything.
Mm-hmm. So, Cathy, why don't you tell us a little bit about the work of Osteoporosis Canada first, and then we'll get into things people need to know about osteoporosis.
Right. So Osteoporosis Canada, so our mission is to educate and empower and support those living with osteoporosis. We're the only nonprofit organization in Canada to do that. And actually, we were the first nonprofit in the world to support those living with osteoporosis. So, like I said, we do support for patients. Any of our literature is all scientifically based. It's gone through our Scientific Advisory Council, which is made up of volunteers who give their time, but these volunteers are healthcare practitioners, physiotherapists, pharmacists, specialists, surgeons, all sorts of people. So they look at the information that we're sharing so that we know if there's scientifically based information, so that you know that it's up to date and current.
Sounds like you have quite a team supporting Osteoporosis Canada in your efforts to get information out to people. What's the first thing that you always want people to know when you're talking about osteoporosis?
The first thing probably is a broken bone is actually a warning sign of osteoporosis. It's not like, oh, well, I just tripped and fell and I'll heal and it'll be fine. It's actually a warning sign to say that, oh, my skeleton is not in good shape. And a lot of people do not put that correlation together, that's quote, the symptom of what osteoporosis is. So I think if anything, I always say, yes, you've broken a bone. And so you really need to get that looked at to see what your bone health is, because that is the symptom that people really don't want to face, I think. Yeah.
Mm-hmm. So doesn't that follow naturally, Cathy, that, you break a bone, you're going to go to see the physician. Isn't it something they would just, as a matter of fact, do to check your bone health after that?
It's a very interesting question, Debbie. We would think so. So our organization, we were pushing really, really hard and getting doctors kind of up to speed as well, that what the problem is, people are fracturing multiple times before some follow-up is done. So it's not always a natural progression to say, maybe that 50-year-old tripped and fell and broke her wrist, and it was casted, off she goes. And then maybe 8-10 years later, she has another fracture. So that's where we really need to start looking. Okay, let's look at the first fracture, because fractures beget fractures. And so what we're really, and again, when we educate the patient and the patients become knowledgeable, they can start asking the questions like, okay, you know what, I'm 50 years old, I've broken my wrist, should I be looking into my bone health a little bit more before I have that second fracture? That could be a spinal fracture, could end up a hip fracture. So these are things that we are really trying to empower the patient to learn what questions to ask.
Mm-hmm. So bone health. There must be something that we can do to make sure that we have healthy bones. Maybe we can start that after a fracture, or perhaps just live a certain way, and I don't know, you tell us, eat certain things to look after our bones throughout our life.
Yeah, so that's the key, looking after our bones throughout our life. Actually, our peak bone mass is actually built when we're teenagers. So for women, it's around the age between 16 and 18 is kind of when you get the height that you're going to get. For men, they're usually 18 to 20, 21. And then you have until about the age of 30 to build on that density. So think of it almost like a bank account, that you can deposit calcium and build your bones like a bank account till about the age of 30. From then on, that bank account kind of closes. You cannot build bone any longer. You just have to maintain what you've built. So from there, from kind of 30 on, we really need to be looking at lifestyle things, getting enough calcium. And we always recommend calcium through food first. So that could look like, some yogurt, a piece of cheese, but it's also lots of dark leafy vegetables, bok choy and kale. We have beautiful things in our gardens and at our farmer markets right now. Those really dark, rich greens. We can look at a fortified beverage. Maybe it's an almond milk or a fortified orange juice. Almonds and some nuts and seeds and beans and legumes. We can look at canned sardine or canned salmon. So it's the bones. So we don't want to throw those bones out. Some people throw those out. We want to crush those bones up, because that's where the calcium is. And then we really want to look at vitamin D as well, and getting vitamin D. It is the sunshine vitamin. So we've had an absolutely spectacular summer and we've had lots of sunshine. But if we're putting sunscreen on, that our body can absorb the vitamin D then. So we want to look at vitamin D supplementation, and that can come in liquids, soft gels, like lots of different things. So we always suggest talk to your pharmacist. So those are kind of the lifestyle, looking at protein, making sure that you're getting some protein sources at every meal to build up that muscle strength as well, to protect the bone. But really when we look at bone health and through the life cycle, We want to be starting with our young people because there was a doctor that said osteoporosis is a pediatric condition that shows up later in life. So we want to build a really good base, and then we have a good resource to pull from as we get older. Mm-hmm.
And that really good base sounds like some very delicious things, nuts and green leafy vegetables. And I can just think about all of the recipes that could be made by people. And I'm sure if they present at their family physician with bone health issues, it seems to be quite likely there would be a referral to a dietitian involved in that. Is that a normal thing for people to be referred to a dietitian so that they can get some help with boosting those great things to eat that would help them?
Yeah, unfortunately, it's not. So again, this is a wonderful opportunity for education. So this is something you can say to your doctor, because a lot of family health teams will have a dietitian that you have access to. So maybe, especially if you have other conditions as well, it's really great to talk to a dietitian. So no, unfortunately, that's not one of the paths that the doctor will send you on. So again, educating yourself is key. So, one of the questions you could ask your doctor could be, could I be referred to the dietitian so that I can kind of see where I can get my calcium through food? Because like you mentioned, there's lots of wonderful options that we can be eating.
Mm-hmm. Well, we've already learned a lot about bone health and about the ways that we can boost our and maintain our bone health into our older years through eating and supplements, vitamin D, for example. And in the second half of the show, we'll talk about living with osteoporosis and the kinds of things that people can do. We're talking today about osteoporosis with a representative from Osteoporosis Canada, Cathy Pearcy, and we'll be back in a minute.